Hi, everyone. Thanks for joining me today. I am here with the North Carolina Coalition Against Sexual Assault. NC CASA is an inclusive statewide alliance working to end sexual violence through education, advocacy, and legislation, and we do everything we do using a social justice framework. So all our work is done from a strong intersectional social justice perspective. We know that if we don't center our work around marginalized communities, their voices don't get heard and their needs don't get met. So we center all our work around marginalized communities. We are the primary training and technical assistance provider for all of North Carolina's rape crisis centers, many of whom are dual DV agencies, some of whom have child advocacy or human trafficking programs. All of our agencies have worked with survivors of human trafficking. We also do legislative and policy work at the local, state, and national level and have a very strong anti-human trafficking program. Nancy Casa has been involved in North Carolina's anti-human trafficking efforts for many, many years at this point. We also do prevention education, and we have a strong campus-based program that includes K-12 schools, colleges, and universities. We acknowledge at the beginning of all of our trainings that not all women are victims, not all men are harm doers, and that anyone of any gender can be a victim or a harm doer. Today, my session is called Reframing Human Trafficking Prevention, a public health, social-ecological, social justice approach. And I know there's a lot in there, but one of the things that I hope to do with this presentation today is help us understand a little more about what we really mean when we talk about prevention. What does prevention mean? And what do people in the public health field, which the public health field does the work to do violence prevention as a health equity issue. What do they know about prevention that we can incorporate to have stronger human trafficking prevention programming? Social-ecological just means that we're not just focusing on changing the individual's behavior to prevent trafficking, that we're looking at the whole context, their relationships, their community, the societal norms and gaps that exist. And then social justice means that we are taking an intersectional lens, that we are interested in how we can do our human trafficking work while also advancing equity and working to end oppression. This is me. My name is Chris again, and my pronouns are they, them, and I am the Prevention Education Program Manager at NC CASA, and I also do a lot of anti-human trafficking work at the national level with several different nonprofits. We aren't going to be talking a whole lot about details of violence today. There might be a few little stories that can bring some stuff up for you, but because we're at a human trafficking conference and we're talking about human trafficking prevention, I want to acknowledge that it's okay to take care of yourself. If you start to feel yourself get overwhelmed, maybe with some breathing or identifying some things you can see in your visual field, connecting to your body, how your seat feels in the chair. And if you need to step away, you can. I do know the conference has people available to support you if you become overwhelmed during a session. I think I just want to start by saying that there's a difference between outreach, awareness, and prevention. One of the things I've noticed is that a lot of people do not quite get the difference between those, and they use those words interchangeably a lot of the times. So I want to help clarify for you that outreach and awareness are not prevention. When we do outreach, our goal is to reach potential survivors to help connect them to services and resources that they need for their healing. That's what outreach is. We're going into communities that maybe have higher numbers of statistical risk factors. We want to identify people who may have experienced harm and make sure they get the support they need. That's outreach. The goal of prevention is primary prevention of perpetration. So there are 3 levels of prevention. We focus a lot on primary prevention because we know that's how we keep people from being harmed, from being trafficked in the first place. And with awareness, awareness is to help people become aware of the scope and nature of the problem in their community. But there's been so much misinformation about human trafficking that at this point, I think most of us who do human trafficking awareness trainings and events and speaking engagements find that the bulk of our work is correcting misinformation. At this point, we do awareness to help correct people's misinformation and myths about human trafficking. So this is a really important model that if you're going to be doing violence prevention work, you want to make sure you're familiar with, and it's called the Social-Ecological model. It's a public health framework for understanding any kind of injury or illness or violence that people experience. And the piece of this that you have to look at first is risk factors and protective factors. Risk factors are anything that the literature shows increases the likelihood of violence occurring, even if they're not causal. So they may not cause it, but they're associated with an increase of experiencing violence. Protective factors are anything that either decrease the likelihood of violence occurring in the first place or increase someone's resilience if they do experience violence or harm of some kind. So those are risk factors and protective factors. And again, we can look at a community and say, we think this might be a risk factor, but if you see things through your observations that you think are risk factors, then a lot of times in the field of public health, they will then test it and do research and surveys to see if that risk factor is indeed associated with a higher risk of experiencing or perpetrating violence. And that's something I want to highlight, is that risk factors, where there's not just risk factors for experiencing violence, there are risk factors for perpetrating violence. For every form of violence, we can identify what are the risk factors that make someone statistically more likely to perpetrate this form of violence. That's an area of research I haven't seen as much of a focus on in the anti-trafficking movement, and I would love to learn more, especially about the environmental and predisposing factors that make someone more likely to traffic someone else. I'd like to know what those are. And that's also a key part of our prevention framework, is that if we want to prevent violence from ever happening, we want to prevent perpetration, right? Teaching people how to keep themselves safe. There's no way you can keep yourself safe enough from all situations. So we want to reduce perpetration. On the left, you see the framework for the social ecological model, which is that all of these risk and protective factors can exist at the individual level, the relationship level, the community level, and the society level. And because there are risk and protective factors for forms of violence at every single one of these levels, we want our prevention to target all of these levels as well, which means a comprehensive prevention approach is going to address all levels. If you're only focusing on one or two levels, you are missing an opportunity to really engage in change. One of the things I like to remind people when I do trainings with sexual violence is that if we take a young person through a curriculum in their school and we give them a lot of information about healthy relationships and bodily autonomy and consent and how to make good decisions and all of this, and then we release them into the same society that has a lot of the same norms that are harmful, our individual and relationship level education with that curriculum, it's not going to stick, because that kid is hearing one thing from us, but something different from everything else in their community and society. So what we want to do with a strategy is think about how can we target risk and protective factors at every level of the social ecological model. This is a chart that is a handout available on the Teach to Reach curriculum's website out of the UNC School of Social Work. Teach to Reach is a sex trafficking prevention and awareness curriculum that NCCASA partnered with them on creating. And a lot of these are adapted from Hannah Beth Franchino Olson's work on vulnerabilities for sex trafficking. And so as you see, there are identified risk factors at every level of the social ecological model, including things that are an individual level risk factor, such as a youth without safe housing. And then we work our way up. A relationship level risk factor might be conflicts with parents. A community level risk factor might be exposure to criminal activity, having a whole lot of exposure to that. A societal level risk factor might be something like glamorization of pimping, right? So these are all things that if we want to have a comprehensive prevention approach, our goal is to reduce risk factors and increase protective factors at every level of the social ecological model. I mentioned earlier, there's also levels of prevention, right? So primary prevention means we are doing strategies to prevent the initial perpetration or victimization. We want to stop the violence before it has ever happened. Primary prevention efforts are guided by theory, strategy, and evaluation. We base them in the theory. We look at the research to see if they're effective. We have a strategy to it, right? We stop and we think about a comprehensive strategy. What are all the pieces we need to bring together for a comprehensive strategy? And then we evaluate it. Is what we're doing effective? Is it reducing risk factors? Is it increasing protective factors? How do we know? Secondary prevention means that we're doing immediate responses after sexual violence has happened to help deal with short-term consequences, to improve outcomes, right? To reduce the likelihood of future perpetration or re-victimization. Tertiary prevention means long-term responses after sexual violence have occurred to deal with lasting consequences. We need all three types for a comprehensive response to human trafficking, and yet we do find that a lot of times we get so invested in those direct service responses, which are so essential and very needed, but sometimes that comes at the expense of primary prevention strategies. So another piece of this public health model of violence prevention is this idea of shared risk and protective factors. All that means is that when we have the public health research to identify risk and protective factors for suicide, for example, once they made that list, if you cross-check that list to the risk and protective factors for sexual violence, a lot of them are the same, right? They share these risk and protective factors across multiple forms of violence. An example, poor parent-child relationships is a relationship level risk factor for child maltreatment, teen dating violence, intimate partner violence, sexual violence, youth violence, bullying, and suicide. Connection and commitment to school is a relationship level protective factor for teen dating violence, sexual violence, youth violence, bullying, and suicide. Societal income inequity is a society level risk factor for child maltreatment, IPV, which is intimate partner violence, youth violence, and bullying. Coordination of services and resources among community agencies, them working together to build a strong safety net, is a community level protective factor for child maltreatment, intimate partner violence, suicide, and elder maltreatment. So many of the risk and protective factors for one form of violence are also risk and protective factors for other forms of violence. You can learn more about this in this PDF that's available at the CDC website. It's called Connecting the Dots. So go online and search CDC Connecting the Dots. You will find two cool results from that. One is an interactive web page where you can select a form of violence, two different forms of violence, and it'll show you all of the risk factors that are shared and protective factors. You could also select the factors and it'll tell you which forms of violence it addresses. You can also find this document in a PDF form, a connecting the dots that includes a chart. And what's super cool about this chart is if you look across it, we don't have human trafficking on it, but we know that human trafficking is a unique criminal definition that often sits, especially with sex trafficking, it often sits at the intersections of child maltreatment, intimate partner violence, teen dating violence, sexual violence, and youth violence. That all five of those are often involved, depending on the age of the victim, that all five of those can be involved in human trafficking and sex trafficking. So what we want to do is look, what are the shared risk and protective factors? And if you find that you're going to start working on harmful norms around masculinity and femininity and diminished economic opportunities and high unemployment rates, then what you can do to reduce those risk factors is find other agencies that have related forms of violence that are also working on those risk and protective factors. And then you can collaborate with a community task force and figure out how can we address these community and society level risk factors as a community, coordinate our efforts and work together. I don't know if your nonprofits are like mine, but we tend to not have money raining out of the sky on us. And those staff that we do have tend to be stretched, right? We're doing a whole lot of work, especially now during this pandemic and with everything else going on. So this is a way to get more done, to have more reach, more impact, more real impact on community and society level factors by sharing resources and working together. Sometimes you'll hear some of these concepts talked about in relationship to social determinants of health. All we mean when we say social determinants of health is that the things that determine whether or not someone has a certain health outcome, which in the public health framework, experiencing or perpetrating violence is a health outcome. Those are often determined by things that are not in that individual's control. A lot of times they're determined by the social environment that that person is in, which can include their neighborhood, the built environment, their access to health and healthcare and what kind of healthcare they're getting, social and community context, education, economic stability. This is something that's really important to remember, especially with trafficking, since so much of economic coercion relies on someone not having economic stability in the first place. If we want to prevent trafficking and prevent vulnerability, we can address these social determinants of health to reduce the likelihood that someone would be trafficked or would want to traffic. So when you're doing a prevention approach, a lot of times for your grants that you apply for, you're going to have to create a logic model. And even if you're not using it for your grants, having a logic model can be really helpful in making sure that you have a cohesive strategy that makes sense, right? That's why we use the word logic. What is the logic of your strategy? A lot of times, I think that I have found that people see a logic model as a nonsense, gibberish piece of like a form we have to fill out to check a box and make a funder happy. And when we do that, when we don't actually dig into why we're making a logic model, we lose the opportunity to learn from a good logic model how we can improve our programming. So in your logic model, you're going to write out what are our inputs? What funding do we have? What staff do we have? What curricula do we use? What strategies? Then you think about your activities. What are you going to do? You want to list what your products are, your outputs. Outputs are products. Funders love outputs, although outputs don't always equate to outcomes. But an output is your product. How many people did you train? How many sessions did you offer? How many clients did you serve? How many materials did you produce? How many coalitions did you form? Did you develop a curricula? But then you want to come up with your short and long-term outcomes. Outcomes are the changes we want to see. And the phrase that I remember for outcomes is, if we implement our prevention strategy with sufficient saturation, we do it enough, we will see these changes in knowledge, attitudes, beliefs, behaviors, and skills, right? We want to be comprehensive. One of the things that can happen when you make a logic model that can be really helpful and insightful is thinking about whether or not your activities are actually going to create the outcomes you want. So there's a list of prevention best practices. I can share that with y'all as a PDF. I don't have it in my slides. But the prevention best practices, one of them is sufficient saturation. And they know that we make a bigger impact by going deeper with a smaller number of people who have higher number of risk factors than we do by just casting a broad net. So for example, if your activity is to do 100 30-minute presentations with well-positioned stakeholders in your community, that's not really going to stick or affect the change you want. But say you find a transitional housing development or a homelessness program, something that does work with people with housing insecurity, and you create a community group for their youth, where you're actually having them engage in community change and activism, and you're actually meeting some of their material and tangible needs and using your funding to help them feel supported and empowered, not just like empowered as in like girl boss, yay, you can do it, but empowered as in like, here is some funding to help you accomplish your goals. How can we help you feel successful in what you want to do with your life and in your community? If we do that with a small group in one transitional living facility or community, we're going to have a much bigger impact than if we go around doing tons and tons of 30-minute presentations. We might have a smaller number of people reached, but the impact we make on those small people is going to be bigger. And so if your outcome is to reduce human trafficking in Happy County, whatever state, but your activities are 1 billion 30-minute presentations to rich people, you're probably not going to make the impact that you want. You are not going to achieve your outcome. So a logic model is a way to look at it and be like, here are my outcomes. Are these outputs realistic? Are these activities actually going to make the outcomes happen that I want to have happen? And if not, change it up, right? Align it to make it make more sense, to have a better logic to it. You will want to make sure your outcomes and your objectives are SMARTY. So I want to encourage you, we talked a lot about SMART objectives, but I want to encourage you to look up SMARTY objectives. You'll find some stuff from the Management Center that outlines how to do that. I'm not going to go into that in today's presentation, but I do want to encourage you to learn more about that. So again, thinking about that logic model, and thinking about the fact that outreach, awareness, and prevention are different things. I want you to look at your strategies when you create a logic model for your prevention program, and I want you to ask yourself, will my strategies support my goals? And are my goals aligned with my outputs and outcomes? So if your goal is to prevent human trafficking in Happy County, whatever state, USA, and all of your activities are outreach and awareness, you're not going to prevent human trafficking. So we want to think, what is prevention? How can I accomplish that with my goals and strategies? So I know that this is a thing where I hear the word evidence-based a lot of the times. And a lot of times evidence-based, people use that to mean, I looked around and I see the evidence. I think it makes sense based on what I saw. And they don't understand that in the public health field, in the education field, when we say evidence-based, we mean something very specific. So I want y'all to know this word and how we use it so that you can use it accurately when you're interfacing with stakeholders. So a curriculum, a strategy, right? It can be a curriculum. Your strategy could be doing an activity that you think will reduce homelessness in your community, might be a human trafficking prevention strategy. Helping do a strategy that provides parents of LGBTQ youth with the support that they need to create more welcoming environments for their children so that they don't end up homeless. That could be a strategy to reduce human trafficking, right? So whatever your strategy is, if it's an emerging practice, it's based on guidelines, protocols, standards, and patterns, best practices that we know are proven to lead to effective public health outcomes, which means before we even start our strategy, we're going to be looking at searching journals to find out who has done similar strategies. What did they find worked? Which part of their strategies did they say made the most impact? Which part of their strategies did they find were less impactful? So we can incorporate their lessons learned and not reinvent the wheel. If you've ever tried to create something from scratch, you may have noticed that you learned a whole lot and you're like, ooh, I'd do that differently now. Why would you want to reinvent the wheel when there's already so much good information out there about violence prevention outcomes in the public health field? So look at what's already out there and learn from this. You're going to want to incorporate a process of continual quality improvement, which means we're going to want to set up an actual protocol for how we learn what's working and not when we start our program or our strategy, so we can continue to improve it over time. And that might mean putting an evaluation plan in place to measure your outcomes. So how do we measure? The way we measure our effectiveness is we look at our outcomes. We look at the risk factors we're trying to reduce. Did we reduce them? We look at the protective factors we're trying to increase. Did we increase them? How do we measure that? And then we set up that system of measurement and evaluation to see if it's actually working. And the parts that are working, we're going to want to pour our resources and time into doing more of. The parts that are not working, we're going to want to either quit allocating as much resources and time to, or we're going to want to change what we're doing somehow to see if that change will then create different measurement outcomes when we evaluate it in the future. If you do your emerging practice and you collect your data and you start to see that it's effective, then you become a promising practice. We're seeing that what we're doing is effective. Now we're a promising practice. We are shown to have some promise and some effectiveness, but we haven't replicated it in a whole lot of different outcomes. If you haven't already at that point, you're definitely at that point going to want to connect to a university or research institution. People, I'm going to tell you, these researchers love evaluating innovative strategies. So reach out and be like, hey, I know that you get funding opportunities that come through your inbox sometimes. If you get one that comes up to evaluate a really cool human trafficking approach we're trying, I would love to be your partner on this. And then stay in touch, periodically forward them your latest measurement data. Hey, here's some of our data we collected. I'm still interested in research, in evaluating this with researcher. If you find that funding opportunity, stay on their radar. And then once you have someone partner with you, and they might say, we're going to replicate it in 6 different communities. And a couple of them might be rural, some might be more suburban, there might be one in a larger city, and we're going to see, are we getting similar outcomes from all of this? And if you start to see that it's effective in a variety of settings with a variety of populations, then it's considered a best practice, right? That's evidence-based. It's been reviewed. There's probably multiple papers published about it by that point. It's replicable in different settings. So that's what we mean when we say evidence-based, is that it's a best practice. I want to name right now, if your program is not a best practice, no big, right? This is not a huge deal. Because you want to be evidence informed, you want to work your way up there. There may be something that's an emerging practice or a promising practice that's really wonderful and innovative. So we're not saying that if it's not evidence-based, it's not effective, it's not good. We just mean we don't have the evidence to support stating that it's effective at what it says it does, right? I also want to name that you might be in that researcher's DMs, so to speak, for years before you find an opportunity to fund it. And if your program is getting good results in your evaluation, you're not going to stop doing it while you wait on someone to be able to research what you're doing and find its effectiveness. And that means that a lot of times getting that evidence base up there can be inaccessible to marginalized communities, to community-based work being done by survivors and in communities themselves, where the communities themselves are coming up with their strategies. I'd like to think that a lot of researchers are starting to learn the value of community-based participatory research, where we have a partnership between people from the community themselves, from the impacted community with lived experience, partnering with researchers, because I feel like those partnerships produce some of the most brilliant strategies that we come across, because you've got the lived experience, you've got the research strategy, you're coming together, you're treating each other as equals, you're really acknowledging each other's investment in this issue and working together to come up with a solution that meets rigorous evaluation and also is real life and realistic, and reflects what people are actually experiencing. So what do we measure when we're measuring the effectiveness of violence prevention programming? We can't measure who didn't get trafficked as a result of our programming. We can't measure whether or not that was effective, partly because you can't measure something that didn't happen, but also because an effective violence prevention strategy that's really working at all layers of the social-ecological model, changing community norms, eradicating poverty, improving homelessness structures, making sure there's access to safe and low barrier substance use treatment. These are not quick turnaround things. These aren't low-hanging fruit. And so they're going to have a lot of different pieces. You might see a change over a period of many years shifting. And then if you have multiple strategies happening in your community at once, you can't identify that that big long change every year has happened because of your one strategy. So this is hard. We can't really measure what didn't happen. And reports are not an effective, like reports of human trafficking going down, going up, that's not an effective measure, because a lot of times when we do an effective prevention strategy, part of that is really clarifying what awareness is happening around what the issue is. And as more people become aware, we'll start to see a rise in reports as a result of our effective strategy before we start to see a decrease in the actual occurrence of it. So we can't really measure that. What we can measure are the risk and protective factors, right? Did we decrease risk factors? Which risk factors do we feel equipped to target? Look at that list and be like, which one of these do we feel equipped to target in our prevention strategy? And then measure, did we decrease risk factors over time? Did we increase protective factors over time? That's what we want to be looking at. You can learn, there's a whole lot of different prevention curricula, which again, most curricula are individual and relationship level strategies. So if you're going to do a prevention curricula as a strategy, if you want it to be effective, you're going to want to think of how to pair it or put it in the context of a community or society level strategy as well. So if you do a prevention curricula, let's go back to our earlier example, with those youth in the transitional housing development, which some of our local prevention subrecipients in North Carolina are doing. If you're doing that curricula with those youth, then you're going to want to make sure you're also doing things in that community. So maybe one of your community level approaches, since we know coordination of community resources is a protective factor, then maybe you want to offer a once a month community health day in that community, to where you partner with people living there to create a fun day. You bring your funding in, you have snacks, you have activities they can do. You have beanbag tosses and games they can play. You have booths that are set up by your local health department, maybe offering free COVID testing. You have something set up from your local partner violence center with a trivia activity about teen dating violence and what's a healthy relationship. Here are ways we can tell a healthy relationship. You might have a booth set up by your local rape crisis center with services, information about services and flyers about their support groups that they're having. You might have your local food pantry come and bring some boxes that they can give away on site to people who need them, right? So start thinking, what with those shared risk and protective factors, what are the other services that these people might need? And make sure they're all in one place, convenient and easy. Transportation, violence prevention, public health, schools, right? Education, Head Start. You're going to want to have everybody there. Maybe you do that once a month, and that's your community strategy. And then maybe you work with the adults in that community to have like a parent support group. So start thinking, how can I layer this prevention curriculum, which is an individual and relationship strategy, with other layers to support the community I'm working in. And if you're thinking, oh my gosh, this sounds like a lot of work, two things. One, yes, it is, but that's what makes it effective as opposed to a low-hanging fruit that's ineffective but makes us feel good. But the second thing is that's why you work on one community at a time. We might not be able to implement this depth of engagement with our whole county all at once. So pick the communities you're going to start with and just really start pouring energy into those communities. And I want to encourage you to think about sustainability, because you don't want to come in and be like, I'm going to come in while I have my grant and do this project with you for a year and then I'm out, right? So how do you build in sustainability? How do you partner with people in the community to find out what they actually want and need and what's going to work for their community, so that it's not some outsider coming in to do a science experiment for a year and then bail? You want to think about real community relationships and partnerships with impacted people. Short and long-term outcomes, I just want to remind you, immediate outcomes are easier to see and make us feel good. They make our funders happy. Those long-term outcomes, they're more impactful. They have a better chance of actually ending trafficking. But long-term outcomes are things like reducing poverty in our county, reducing homelessness in our county, reducing unemployment, really building economic opportunities, changing gender norms in our community, making our communities more LGBTQ friendly, eradicating racism in our community, changing immigration policy in our area. These are all things that are really big fish to fry, right? These are big things to tackle, but those are the ones that are really going to have a better chance of actually ending trafficking. So don't get so excited about setting up short-term, separate, scatter, immediate outcomes that we forget it all needs to fit in to a big picture, a long-term picture of what we're doing for prevention. So set up short-term outcomes that measure steps towards our long-term goals. When you think about where to focus our efforts, again, I want to remind you that this whole idea of hotspots and hubs, to me, I don't even listen to it anymore. I'm like, meh, everybody's a hub, everybody's a hotspot. Everybody's like, we're a major hub of trafficking, when the reality is anywhere you have people, there's going to be an increase in trafficking. If there is an increase of people in a concentrated area, there will be an increase of all sorts of things that happen, including trafficking. So if you look at this map, that is the hotspot map for the National Human Trafficking Hotline calls, it's a whole lot like the map of the US population. So if you live in one of these red cities on the left with a high US population and you feel super excited about how important your work is because you're in a trafficking hub, I want you to remember that trafficking happens where people are. That's just how it is. If I really wanted to see some cool research on prevention, I would be looking at these areas that are a hotspot on the National Human Trafficking Hotline map that are not hotspots on the US population. So if you look up here, I don't know if you can see my cursor, But there are some up here where you're like, wow, that's a trafficking hotspot, a hotline call hotspot there, but not a US population hotspot. What is happening there? That's an interesting question. If we want to move away from this useless concept of hotspots and hubs and really think about where are hotspots for trafficking that aren't hotspots for population, that would yield some interesting results. And I did this slide with a training once, and one of the ones that I picked to point to and say, why is this hotspot here but not on the population? And someone who was on the call who was former military was able to point out that that's a military base. So be thoughtful and a little bit of a critical thinker about how you talk about hotspots and hubs. We don't want to perpetuate myths. When we're looking at prevention, we know that there is a range of consent for adults and there is a range of consent for youth. So with adults, what we consider a severe form of trafficking is where there's force, fraud, or coercion. That's where we're talking about trafficking and sexual assault. There are also truly, genuinely, 100%, there are some people who chose engagement in the sex trades freely out of a range of options. Depending on the study you look at, 15 to 25% of people in the sex trades chose it freely, were excited about it, they have enthusiastic consent and willingness. Now, there are the vast majority, according to studies, the majority of people in the sex trades, kind of like the majority of people in all forms of precarious work, precarious or stigmatized work, say that they would do something else if they could do it, that if they could get out, they would do something else, but that's not unique to the sex trades. And when you look at this range of consent, the spectrum of consent, a few things I want to highlight. One, there was a recent study by Gerasi and Peterson that found that when healthcare providers were not trained in the range of consent, because they couldn't understand the difference, they actually were less likely to screen and offer services and ask useful questions about someone's experiences in the sex trades that could have yielded support for a trafficking survivor. So it's very important that our trainings address this range of consent. And secondly, how we prevent it is going to be different based on where someone is in that range. So criminalizing engagement in the sex trades isn't going to reduce a lot of these. If there's someone choosing it because they don't have any other options, then the way we prevent it is by giving them other options, right? If someone's like, I would do something other than sex work if I could pay my bills without working 40 hours a week because I have a disability and still afford my health care. Well, then that's an opportunity for us to do prevention by making sure they have other options for meeting those needs without needing to be in an exploitative work situation that they don't love. That's also the case for people in food service, coal mining, a lot of people in healthcare. I did this training once and someone who was a lawyer said, I would imagine that a large number of lawyers would change and do a different job if they could afford their bills and make the same money doing something else. So remember that this range of consent impacts the kinds of prevention we think about that will be effective. Again, with minors, I just want to affirm again that the range of consent with minors, it's all trafficking, right? But even with minors, even with it all being trafficking, if we can make sure that youth have safe housing, loving families, access to trauma treatment, that their parents are well supported, then we can still reduce trafficking. So I like to ask people when I do this training to think about it for a moment. Would you rather spend a night in a haunted house or sleep in a completely dark cave full of bats? And just think about that for a minute. Throw it in the chat if you want. And one of the things that I find, first of all, is that people tend to pick bats, which is kind of funny because at least, for me, when you ask them, why did you pick the one you pick? They'll say different things. They might say, I would rather sleep in the haunted house because at least then I can get out. Like being in a closed up cave feels scary. At least the haunted house has a door, which to me is funny because I'm like, have you not watched a horror movie where the door doesn't open? Come on. Sometimes they'll say, I'd rather be in the bats because at least I know what a bat is. I know what to expect, right? That feels less scary than this unknown of a haunted house. Sometimes they'll be like, I would rather sleep in the haunted house because I don't believe in ghosts. Sometimes they'll be like, I would rather sleep in the bats in the cave because bats are nocturnal and they'd be out at night anyway, right? So they're going to have a lot of different responses based on their own personal experiences. I share this activity Because a lot of times when we look at things that leave people vulnerable to trafficking and how they end up in some of the situations that they are, we assume that people are just choosing between a haunted house and a luxury hotel, when the reality is there are options that are available to them are a haunted house and a bat cave, right? They don't have that many good options. And so these decisions that someone might make in terms of not wanting to leave a situation or staying in a situation that feels harmful or whatever may not make sense to us because we don't understand that they're choosing between the options that are available to them that are not ideal. And the 5 domains of well-being framework from the Full Frame Initiative is a way to look at that. I'm not going to go into it a lot, but the idea is people may have things that they need to feel safe and like they have a sense of well-being that are in conflict with each other. Their safety, if they prioritize their safety, they may lose social connectedness. If they prioritize their stability, they may be less safe. And we have to understand these trade-offs. This is a very useful framework for safety planning. 5 domains of well-being has a well-being planning toolkit that's essentially a safety planning toolkit, but it's also good for prevention. Because if we can reduce the trade-offs people need to make to have access to safety and social connectedness and mastery and stability, then we can reduce violence. We can reduce violence before it ever happens. So I have a composite case study I like sharing with people to illustrate these ideas. So what if we have a 16-year-old transgender girl and her parents told her she can't stay at home unless she answers to her dead name, dresses like a boy, and tolerates being referred to as him. When she's at home, she feels suicidal. So she chooses to go back and live with her trafficker, who at least treats her like a girl. And this is a composite story, but it's one that I actually have gotten multiple calls with variations on the same theme. And the parents are like, why are they not wanting to be safe? The caseworkers are like, why don't they want to be safe? Why do they keep running back away? And so I want to think about what her options are. She can stay at home and be misgendered and have conflicts with her parents, or she can live with her trafficker where her identity is supported and she has to engage in sex with her trafficker's friends that she doesn't want to do. And so there's trade-offs. Both of these don't feel good. How do we figure out what feels more or less safe? So there was a study by the Trevor Project, their national survey on LGBTQ youth mental health in 2020. And what they found is that youth who attempted suicide, if you sorted it out by the number of people who respected our pronouns, for the youth that all or most people in their lives supported and respected their pronouns, suicide rates were significantly lower. When you ask them, had anyone ever tried to convince you to change, either engaged you in formal conversion therapy or had tried to convince you to change who you were, that they're over twice as likely to attempt suicide. And so when I've had these cases similar to that composite story and I call them and say, you know, what's going on? They're like, when I'm at home, I'm suicidal all day, every day. At least when I'm with my trafficker, I'm not suicidal all the time. And the fact that someone is facing those two as their options breaks my heart. We need to be creating better options for people. We need to give them choices so that they can be safe in the first place without having to choose between two horrible situations that no one should be stuck in. How do we change that? That's, to me, that's real prevention, these kinds of situations. There's an activity I do sometimes to get at the root of root causes called the 5 whys, where we keep asking, why is that? Why is that? So let's use this composite story as an example. Why is this person at higher risk for sex trafficking? Because she's a youth without safe housing, right? Either because she's running away or because she got kicked out. Her family doesn't accept her, so she doesn't have safe housing. Why does she not have safe housing? Well, because of conflicts with her parents. Well, why does she have conflicts with her parents? Well, because of their adherence to community, gender and gender expression norms, right? Community norms. Why are these the norms in their community? Because of social norms about gender in our society and about trans people. If we go through this 5 whys, what we see is that for every individual level risk factor we can identify, if we trace our way up, we can usually land on something we can change about our society. We can usually land on something about our community that we can identify as an outcome for our logic model, right? So all of these are related. This whole social-ecological model levels, they're related. Reduction of vulnerability begins with addressing the systems and community norms that leave people vulnerable. And so if you think about risk factors like poverty, gender inequality, stigmatization of precarious labor, immigration status, community and cultural norms, compromised parenting or caregiver strain, lack of safe housing, look at this list and figure out how you can help address these in your logic model, right? If we can reduce people's needs to choose between haunted house and bat cave, we can help prevent vulnerability to trafficking. And again, just one more way of painting the idea that many of these individual level risk factors are connected to societal level risk factors that we can work on in our messaging. Someone who is a Black or Indigenous person of color, the societal level risk factor is racism and colonialism. Someone's immigration status being a risk factor really means that our immigration policy is a risk factor for them. Someone being LGBTQ having an increased risk is because of homophobia and transphobia. So trace your way through these and start thinking up the social-ecological model. The public health field and the CDC call that outer layer prevention. And that is a big focus right now, is how do we prevent violence at the outer layers so that we're sending people into communities where they have a chance of being safe. And our anti-oppression lens matters for a lot of reasons. Youth of color are vastly overrepresented among youth being exploited. Lesbian, gay, and bisexual youth are more likely than their heterosexual peers to be exploited, and trans youth are even more likely than their lesbian, gay, and bisexual cis peers to be exploited. And if we focus our prevention and response programs on one population, we're going to miss opportunities when, for example, LGBTQ youth of color don't see their experiences represented or honored in our outreach programs. I am, in the interest of time, going to skip through these next files, but I will turn this into a PDF, some ideals into practice opportunities. And again, remind you, we can't measure who did or didn't get trafficked, but we can measure changes in risk and protective factors, shifts in knowledge and beliefs and attitudes, who got housed, who got access to substance use treatment, changes in policy and legislation and about immigration, LGBTQ, racial equity and inclusion. What else can we measure? I want to share in closing this quote from Deborah Gibbs during a keynote in 2020. Many survivors of human trafficking were forced, defrauded, and coerced by the violence of systems and gaps. What are we doing about the collective violence of systems and gaps? How are our prevention methods addressing this kind of violence, the violence of systems and gaps? This is not small fish to fry, this is not low-hanging fruit, but these are the things we really want to be addressing, because no one person or policy can end trafficking, but each of us can do our part. I think I'm going to stop now, so if y'all have any questions, definitely feel free to ask them now.